This past week, we reached two sobering milestones. We've saw 800,000 deaths in the United States and 10,000 deaths here in Minnesota. We're rapidly approaching 200 deaths of our neighbors here in Bloomington. We continue to see high levels of COVID-19 in our community. This graphic represents what we're seeing on a regular basis. You can see the last few weeks have been this high level of up and down. That high level is primarily Delta in our community right now and continuing to cause challenges with high levels of transmission. The challenge is this is straining our healthcare system. So many of you saw this in the Star Tribune. Our healthcare system is asking for help. They're asking for people to get vaccinated, take care of themselves. They're overwhelmed and broken. The reality is these high rates are causing concerns that make me the most concerned that I've been this entire pandemic about our healthcare system and capacity, and I'm very worried for what we're going to see in the next few weeks. The unthinkable, no hospital beds, is starting to become a common occurrence due to the rising number of COVID-19 cases and limited staffing. Your wait times will be longer, and you may wait a long time to be admitted to the hospital if one hospital bed is available. Our fire chief shared this situation leaves ambulances with little resources, but to bounce back and forth between hospitals, this condition is slowly and steadily getting worse. You can see here, this is data from the 17th. On that day, we had 3 ICU beds in the entire metro and a smattering around the rest of the state, and we had 28 adult med-surg beds. Our pediatric situation was a little better. We had 7 beds, but only 4 non-ICU beds in the metro. That is just really concerning from a healthcare capacity standpoint. At the same time we're experiencing limited healthcare capacity, we're also preparing for the impact of a new COVID-19 variant known as Omicron. While there's a lot of uncertainty around Omicron, everything we know and learned so far is concerning. This may be the biggest challenge we face yet with COVID-19. I'm also recognizing this is a message nobody wants to hear. It's not a message I want to be delivering, and the timing is incredibly challenging. There are many things we focus on when a new variant emerges to try and understand the impact. The first is it more transmittable? This case, Omicron is more transmittable than Delta. The variant makes up the majority of the cases in Minnesota right now. We expect that to rapidly change. This means as more cases go up, Omicron is going to be out competing or infecting more people than Delta can. The second area is, will it cause more severe illness? At this point, less than a month since this variant emerged, we're still learning about the clinical picture. Some data suggests it may be less severe. With older adults and people with comorbidities, we don't have much data. We don't know what it's going to happen when it spreads in those communities. Early data out of Denmark shows that in the first 785 cases, about 1.2% were hospitalized and 1 needed intensive care. Most of them were vaccinated. Even if Omicron is less deadly than Delta, the growth is exponential. We're going to see severe cases, and that's going to challenge our healthcare system. The third area is what we look at with how vaccines and testing work with the new variant. PCR tests are going to remain key, and they work very well. Rapid tests are useful for letting you know if you're infectious at that point in time. They require a second test later, and if you're symptomatic, often a follow-up with PCR. There's work ongoing right now to validate and confirm that they still work well against Omicron. There is decreased protection, however, against infection in persons that have been fully vaccinated compared with other variants. A booster dose raises the level of protection, but breakthrough infections have occurred. We expect to see reinfection in people who have previously been infected. These data have been reported elsewhere, including in people that are infected with Delta recently. Protection against severe disease when fully vaccinated or boosted is anticipated to remain strong. Our vaccines are working to protect against that severe disease. Individuals that are fully vaccinated and have recently received a booster will have the highest level of protection. Vaccination is our best tool to reduce the impact of Omicron in the community. If we follow the trajectory of other regions, we can anticipate a surge of cases in Omicron in the next few weeks. We expect cases to double every 2 to 3 days. The speed will be surprising to many as conditions will change rapidly. Even if we don't see a change in cases with clinical severity, the volume of exponential growth will be a challenge to manage. We don't have the capacity now with Delta, so this is incredibly concerning to me. We've made phenomenal progress with vaccination. with an estimated 80% of our community over the age of 5 fully vaccinated. That's a phenomenal success, and we should be incredibly proud of that. That's a fantastic number, but it's not enough to control what's coming. Vaccination is our primary tool, but it can't be our only tool. With such high case rates and a variant that has some immune escape. The more layers of mitigation we use, the better protected we will be. The choice we make in the coming weeks will impact us all. As cases surge, you can expect businesses to have staffing challenges as staff are impacted. You'll see retailers and other businesses ask people to mask up again as staffing becomes a challenge. We all can take steps to slow the spread of COVID-19 in a community, and the more we work together, the better we can weather what is coming. I'm tired of dealing with COVID-19. I don't like wearing masks, and I long for the day that I don't worry about my kids, my family, myself, my community, loved ones getting sick, hearing about a tragic death, or somebody struggling with long COVID. I think that day will come, but it will come based on their collective actions to change the trajectory of COVID-19. We've done this before, and we're going to need to rally again to get through the next few weeks. Bloomington Public Health is asking everyone to take the following steps to care for ourselves and our community and to stay safe. Be cautious with your activities. Avoid illness and injury in the coming weeks as healthcare access is going to be delayed. Think about wearing your seatbelt, making sure your kids are secure in their car seat. Be careful walking on the ice. Get your flu shot if you haven't already. It's not too late. We are seeing influenza cases starting to rise in Minnesota. Get vaccinated against COVID-19 and get boosted when you're eligible. This is our best strategy to reduce your risk of severe illness. Wear a high-quality mask that seals around your face when you're in indoor public spaces or areas of high community spread. COVID-19 is spread when an infected person breathes, talks, laughs, coughs, or sneezes. It's in the air you breathe, which is why you want a good mask. Gather outdoors or in areas with good ventilation. Avoid crowded indoor spaces. Get tested if you have close contacts with somebody with COVID or have any symptoms. Consider how you may limit your activities in the coming weeks. And if you are gathering, adjust your event to minimize risks. We have tips and strategies to help you do that at blm.mn/reduce-risk. Our healthcare system is stretched to the breaking point. We are a caring community. Show your neighbors you care and do everything you can to ensure a bed remains for those who need it in an emergency. Show our healthcare partners you care by doing everything you can to avoid needing emergency medical care in the coming weeks. We're going to get through this. We're going to do it together. But we have some serious challenges ahead of us. Take care of each other, Bloomington.